Hey everyone, and welcome to The Explainer. Today, we're diving into a really fascinating medication called Bicalutamide. It's got this incredible dual life, it's a key player in fighting cancer, but it's also a vital tool in gender-affirming care. So, let's get right into it.
Right? So that's the big question, isn't it? How on earth can one little pill do two things that seem so completely different? Well, it all comes down to its mechanism, which is actually super specific and, surprisingly straightforward.
Okay, so what is this stuff? At its heart, bicalutamide is what's known as a synthetic, non-steroidal drug, and it's part of a family of drugs called antiandrogens. That probably sounds a bit technical, so let's unpack what that really means.
Basically, an anti-androgen does exactly what it sounds like. It works against androgens. And androgens are just the technical term for male sex hormones. You've definitely heard of the main one, testosterone. Bicalutamide whole job is just to stop testosterone from working.
So, to really get how it does this, we're going to use a super simple analogy, a lock and a key. Imagine that all over your body, your cells are covered in these tiny little locks. And testosterone? Well, that's the key that's perfectly shaped to fit right into them.
All right, so here's how it normally works. The testosterone key floats around your body, finds one of these special locks, which are called androgen receptors, and fits right in. When it binds and turns that lock, it's like opening a door to a set of instructions that tell the cell to do things like grow facial hair or affect the prostate.
Okay, but now enter bicalutamide. Think of it as a fake key. It's shaped just right to slide into the lock, but it's a blank. It doesn't have the grooves to actually turn the lock, so it just gets in there and sits. It jams the lock. Now the real key, testosterone, comes along and it can't get in. The door never opens, and the message is never delivered. Simple as that.
And this is a really important detail. In pharmacology, they call bicalutamide a pure antagonist. All that means is that its only job is to block. It doesn't accidentally jiggle the lock a little bit or partially open the door. Nope, it just blocks. That's it. This makes it super predictable and clean in what it does.
So now that we get how it works, let's look at the first big reason it's used, fighting prostate cancer. See, a lot of prostate cancers are what we call hormone sensitive. That means they literally use testosterone as fuel to grow and spread. They pretty much feed on it.
Now, when it comes to cancer treatment, bicalutamide is rarely used alone. It's part of this really clever two-pronged attack called combined androgen blockade, or CAB. Think of it like this. Step 1, another medication basically tells the body's main testosterone factory to shut down production. But there's still a little bit of androgen made elsewhere, like in the adrenal glands. So step 2, bicalutamide comes in to do mop-up duty. It blocks the receptors from that remaining little bit.
And the whole point of this double whammy? It's to achieve an almost total androgen blackout. You're essentially starving those cancer cells of the very hormone they need to survive. Cut off the fuel, and you can slow the cancer's growth, or sometimes even shrink it.
All right, let's totally switch gears now and look at the other side of this coin. It's the exact same lock and key blocking action, but used for a completely different purpose. Bicalutamide has become a really important, though technically off-label tool for trans feminine people in their gender-affirming journey.
So in this case, the goal is obviously not to treat a disease. It's about helping someone's physical body better align with their gender identity. By blocking testosterone's effects all over, it helps slow down or reduce androgen-driven things like facial hair, body hair, or male pattern baldness. This clears the way for feminizing hormones, like estrogen, to do their work more effectively.
And this often leads to a comparison with another really common antiandrogen called spironolactone. A lot of folks, both doctors and patients, actually prefer bicalutamide. Why? Well, because it doesn't have some of spironolactone's more disruptive side effects. Spironolactone can make you pee a lot, it can mess with your electrolytes and your blood pressure. Bicalutamide just doesn't do that stuff.
Okay, so this is a really important question that trips people up. If bicalutamide doesn't actually get rid of the testosterone in your blood, how do you know it's working? Remember, it's just blocking the locks, not getting rid of the keys, so checking blood hormone levels is kind of pointless. Instead, doctors and patients look at the real-world results. Is body hair growth slowing down? Are the physical changes happening? That's how you track it.
So, whether you're using it to fight cancer or as part of a transition, the basic action of the drug is identical. And that means the risks and the side effects are the same for everyone. This part is super, super important for anyone considering this medication.
And we have to talk about the big one, there's one potential risk that is by far the most serious. Now, it's not common, but you absolutely have to know about it. And that risk is called hepatotoxicity. It's just a fancy medical word for liver damage that's caused by a drug. See, your liver has to do all the work of processing bicalutamide, and for a small number of people, that can cause some serious stress, inflammation, and damage. And in really, really rare cases, it can be severe.
So this brings us to what is maybe the single most important takeaway. If you take bicalutamide, you have to get regular blood tests to check on your liver. These are called liver function tests, or LFTs, especially when you're just starting out. This isn't optional, it's not a suggestion, it is absolutely essential for using this medication safely.
Now, what about the more common side effects? Well, these are pretty much what you'd expect from a drug that blocks testosterone. Things like breast tissue growth, that's called gynecomastia, hot flashes, feeling tired, it all makes sense. And here's where the context is everything, right? For someone in feminizing therapy, breast growth is the goal. But for a prostate cancer patient, it's an unwanted side effect. It's the exact same biological effect, just viewed through a different lens.
All right, let's bring it all home. What are the main things you really need to remember from all of this?
First up, this little number right here, 7 days. That's the drug's half-life. That means it takes your body a full week just to get rid of half of a single dose. That's a really long time for medication.
And the reason that's so great, practically speaking, is that it makes dosing super easy and effective. You just take one pill a day, and because it sticks around for so long, you get this really steady, consistent, around-the-clock blockade on those androgen receptors. No big ups and downs.
So to put it all in one place, what is it? A pure androgen receptor blocker. What's it for? Primarily in combination therapy for prostate cancer. And off-label? A key tool in feminizing hormone therapy. What's the number one risk? Liver toxicity or hepatotoxicity. And how do we manage that risk? With essential, regular liver function tests. That's the whole story in a nutshell.
And this all kind of leaves us with a bigger question to think about. Bicalutamide is a perfect example of modern targeted medicine. It's like a molecular scalpel. It does one very specific job, and it does it incredibly well. But with that kind of power comes pretty serious risks and a huge amount of responsibility. So as we get even better at making these super specific drugs, how are we going to navigate that balance between incredible power and potential danger? It's something we'll all be facing in the future of medicine. Thanks so much for tuning in.